Well, it's great to be here and see a lot of familiar faces. So I'm really pleased to get to moderate the panel on the youth topic, and of course I'm not sure exactly how we got stuck following the previous speaker, but hopefully I think we have three terrific panelists, so I'm sure there'll be some really good insights on the topic of policy and programming challenges on meeting the needs of young people. I feel like our last speaker was, if nothing else, proof positive that it's not just about sort of meeting youth's needs, but thinking about how to incorporate them as some of the leaders and the thinkers behind how to do this. So certainly a challenge and something that the foundation that I work for, the Summit Foundation, has been trying to do that for a dozen years. But I still see, even within my own foundation, that sometimes an adultism creeps in of thinking that, are we really sure that this is going to work to have a younger person involved in meeting youth needs, whereas on the other hand, I think we need to trust youth much more than we do. So I think we'll hear a lot more about that from our three panelists. And actually, I'm not going to read bios because I think that's not really that helpful when you all have them in black and white in front of you. But they are three terrific speakers, and I think it's kind of funny that we have three of the four of us up here are, shall we say, non-youth, and one person who I still think is very much of a young person, and that's a valuable perspective. And also, interestingly, the three of us older folks up here have all been, I guess, more or less in our fields for about 17 years. So it seems like that was a prerequisite to be on the panel, unless you were a young person like Christelle. So I'm going to start out by turning the floor over to Marianne Yerkes from USAID and hear from her first. Thank you.
Thank you. Is the microphone working? Can you hear in the back? I hold it close to just be really loud, right? So thank you so much. I want to thank the organizers, first of all, for inviting us here, because I think this is really critical to have an opportunity to speak with you about the Youth and Development Policy. My name is Marianne Yerkes. I've been serving as the interim coordinator for youth at the agency while we're waiting to get a full-time coordinator. So that's, normally I'm in the Democracy, Conflict, and Humanitarian Assistance Bureau, working on advocacy issues and civil society. So I'm also very interested in this topic. But just to start, briefly, I'm sure most of you know that we have a Youth and Development Policy at the agency, and I'm not going to read through all of this, but I just wanted to put up here as a reminder what the goal of the policy is and the core objectives. And please forgive me, I'm fighting a cold. I'm not supposed to say that in a health conference, right? But so if I clear my throat, I apologize, and especially since you're recording this. But really briefly, the objectives, the core objectives, are to strengthen our youth programming across the mission of our agency, strengthening and increasing investments in youth, and to mainstream youth into our existing agency initiatives, and to strengthen youth engagement. I think that that piece is absolutely critical. As a reminder, here are the guiding principles that are outlined in the policy, and the top one is youth participation and engagement. We've been talking about that during this last session. I think it's pretty obvious after hearing Jack speak why this is critical. But these are some of the other core principles also that are mentioned. And then also the policy lays out a conceptual framework, if you will, for engaging with young people, which includes supporting an enabling environment, ecosystem for working with youth, protecting the rights of young people, and ensuring that the programs that we have kind of align with what we know to be international and human rights regulations, and et cetera, and to prepare young people, ensure they have the skills and supports that they need to engage in terms of the capacity development. But what I wanted to focus on, in addition to a reminder of kind of the core issues in the policy, is just to kind of speak to you about where we are with policy implementation to date. So basically, since the policy was released, we've pulled together a team of different people from across the agency, from global health, from the different pillar bureaus, from the different regional bureaus, to develop an action plan. And a number of you, through the Youth Health and Rights Coalition, have provided input into that action plan in terms of what you think we should focus on. And I would say that one of our top priorities in going forward, again, was to create a structure within the agency to implement the policy. So to try to get a full-time coordinator to take over from my role and also to get points of contact in the bureaus, to kind of reinvigorate our existing interagency youth working group, and also to look at ways to have a youth engagement aspect, a platform for engaging young people in our work. So from councils to more creative ideas of how to use the internet, et cetera, to engage with young people. So this has been a top priority. Also, in terms of the action plan, and I'm going to go over very quickly some core components of that. And obviously, we still welcome people's feedback as we roll this out, ideas that you have. We're listening very carefully. So just to outline some of the core objectives that align with the policy. So first, we want to really improve the quality of the work that we're doing, as I mentioned, the programs. And so what we've been playing with, and again, this action plan is still draft. We need to get agency approval of that. So that's not yet been done. But basically, we're looking at focusing initially on 2 to 3 countries potentially where there are strong youth programs, where missions are already committed to the issue of youth, and really explore what does it mean to implement this policy. A lot of people will say, of course, youth are important, but when you say integrate or mainstream youth, people are confused as to what that means. So to try to focus on a few places and really show success in policy implementation. And actually that aligns with one of the recommendations of the coalition, which was to actually focus your efforts. Another point that they had made too, or you had made, was to maybe identify countries that are maybe not there yet in terms of doing youth work, but should be. So that is an idea as well. In addition, we're looking, as I mentioned, to strengthen the structure, which is absolutely critical. So that's kind of our objective 2, if you will. And then objective 3 is really looking at elevating young people in our strategies, so thinking through in strategic processes. So that could mean obviously continuing to track core countries through our planning processes to see if we should be working on youth issues. But that also means socializing the policy within the agency. That was another core recommendation of the coalition. So for example, ensuring that we're always speaking about the policy at key meetings, be it with other donors, meetings like these, et cetera. So to really try to socialize this. Also to target some core initiatives within the agency, and that can be in the global health space, for example, the GHI, the Global Health Initiative, the work with PEPFAR, et cetera, and to focus our efforts there. I won't go through the whole list, but you get a sense of this, and also the post-2015 discussions, which you're working on to really look at how we can try to influence those. The next objective area is really about strengthening capacity within the agency, and so that's recognizing that a lot of us don't really know what that means in terms of integrating youth or how to work with youth. So looking at strengthening, having capacity development training programs, identifying and creating tools and technical guidance. You may have already seen some guidance produced by the Global Health Bureau in terms of working with youth in global health. Also conducting trainings and potentially regional trainings. And then the 5th area is basically increasing knowledge and evidence in terms of youth development engagement and looking at opportunities to do evidence summits, for example, or more roundtables, more impact evaluations. So we're hoping to see more of that. So that just highlights a few of the areas in the action plan, and we can speak to other issues and questions that you may have as we move forward. But really quickly, just to highlight a few points in terms of how we can coordinate and work together. One is obviously socializing the policy. So as I mentioned, continuing to include the policy and other donor policies on programs. If you're in charge of an agenda at a big health conference, please ask us if we're not there to come and speak. So I think that's essential, really working together to get the message out. It's obviously up to us, but your assistance can really help. Also, if you're going out to programs or to missions and you meet with USAID officers, ask them about the policy. They may not know, so then if you know about it, you can inform them. I mean, obviously, we have a lot of work to do at the central area, but we could use your assistance in terms of keeping the dialogue going. Also, to continue to advocate on issues of youth. Clearly, we face challenges that you probably face as well in terms of how do we do cross-sectoral youth development, integrated youth programming, and how do we advocate on that to have more flexible use of funds. And then to continue sharing lessons learned as well in terms of effective youth programming. If you have good examples, if there's technical guidance that we can pull together, and to hold us accountable. One final note I would say in terms of youth engagement, we've also created I'd say kind of a sub-working group or team structure within the agency to work on these different fronts to move forward with the action plan. And one of those is focused on youth engagement. So really looking at platforms for engagement. For example, what we were talking about in the last session, we have Grand Challenges that you may be familiar with. Grand Challenges for Development. Our Development Ventures Innovations programs, DIV, are opportunities to engage with young people and provide those challenges. Also, our Higher Education for Solutions Network is a way to link students and universities. So I will close on that and thank all of you. I'm thrilled to be here again. It's terrible that we're going after Jack, and just last night I was with another TEDx team named Kelvin Doe from Sierra Leone. Jack probably knows him, but he's also an amazing young leader who basically at the age of 10 started to create his own radios, his own batteries, and his own community radio station. And so we're talking with them and look forward to the continued discussion on ways we can engage more fully with youth. So thank you very much.
Okay, thank you for having me. I know that I know many of you in the room, but for those of you that don't know me, I'm the Senior Adolescent Youth Sexual and Reproductive Health Advisor at Pathfinder. And I had been asked to just come and share some insights and examples from Pathfinder's work, both in terms of challenges and successes, in terms of implementing programs, but also advocating on the policies and resources that are needed to support young people's sexual and reproductive health and rights. Okay, so coming from an organization that has worked on young people's sexual and reproductive health and rights for decades, and I won't say that I've been there for decades, but I have been there for a long time. I've actually witnessed how the field's evolved over time. And so earlier on, I think, mostly the focus was on youth-friendly services and comprehensive sexuality education, and not to minimize the importance of those two interventions because they're still definitely needed. But I think as a field, we've really moved beyond that to be looking at specific populations and their unique needs, and also to look at young people's sexual and reproductive health and rights within a broader context of health and development. We're seeing more focus, not just with USAID's youth policies, but even by other donors and on the field in terms of things like positive youth development approaches, multi-sectoral programming that speak to this more holistic, broader approach. For some of you in the room, you remember in 2008, Pathfinder launched a campaign called 3 Billion Reasons, and that was focused on increasing attention and investment in young people's sexual reproductive health and rights. And the reason for that campaign was that it was in response to the fact that there had been a wane, and in some cases a complete lack of interest and investment by donors and country governments and young people, despite the fact that at that point in time we were facing the largest number of young people in history. And so one of the things that happened at the beginning of that campaign was we actually conducted some research to just better understand why this issue wasn't gaining traction with those that we were most trying to reach out to get commitments, and then how could we do a better job at advocating for real commitments to young people's sexual, I'm going to just say SRHR, it's too complicated. But what I'd say is since then we've actually seen a growing commitment to young people's SRHR. We still have a ways to go, but just to give us some encouragement, there have been increasingly more expert consultations on adolescent youth sexual and reproductive health by WHO, UNICEF, UNESCO, looking at not just global guidelines, but also what research priorities should be like. We're also seeing more advocacy organizations and coalitions taking on these issues, including some of those that historically had not been involved in these topics. So, one example is the Partnership for Maternal Newborn Child Health, which is recently, it's currently in the process right now of developing an adolescent health strategy with a focus on adolescent pregnancy. And then lastly, just to mention that there is increased recognition, I think, right now, both by donors and governments, that the development and health of countries is contingent on meeting the needs of young people. And part of it has been centered around this argument of the demographic dividend, and part of the other argument is just a rights-based argument, but I think both of those in tandem have helped us with some movement on this front. Okay, so despite these growing commitments and broadened understanding of adolescent youth sexual and reproductive health, there's still challenges that remain, and so I just want to quickly highlight 4 of them for you. The first is many of us have been advocating on this issue for a long time, which is the need for age disaggregated data. If we don't have age disaggregated data, we don't know who we are reaching, with what, and most importantly, we don't know who we are not reaching. also without age disaggregated data, as we're looking at more, there's more efforts on scaling up services and programs, how do you make good informed programming decisions if you don't have the data you need to make those decisions? And then lastly, it's really hard to work with governments and donors and communicate some type of return on investment if we don't have the data to be able to answer their questions. So to just link this to an example in the field from Pathfinder's work, we've been working in Ethiopia on the Integrated Family Health Program, supporting the scale-up of youth-friendly services by the government. When we started that initiative, like many countries, the national HMIS, the only thing they disaggregated by age was HIV counseling and testing, which is mostly due to PEPFAR. Aside from that, there's no age disaggregated data, which really was a problem for us, both as an implementer, but then also a problem for the government in terms of they were investing their own resources into scaling up youth-friendly services, but then really aren't able to say, okay, out of the total number of people receiving contraception, which portion of that is young people? And so it's a small success. There's still a ways to go, but Pathfinder and several of other organizations that are in the room have been working really hard there's a national working group, and they just put forward the recommendations to the Federal Ministry of Health for age disaggregated data on a variety of services. And so we're awaiting a response. They're expecting a response in a week or two from the federal ministry. Another challenge is cross-ministry coordination. As I mentioned, I think with USAID's youth policy, one thing that's of interest, and I think we have been speaking to USAID a lot about this, is how, to implement the vision of that policy is really going to require multi-sectoral coordination and cooperation, and yet we all know traditionally people work in their own stovepipes. So that is a challenge, and how do you build the capacity of these ministries to be able to not just coordinate but plan and monitor programs jointly. And so in Mozambique, we have this Jetta Sambi's program, which is multi-sectoral with 3 ministries: Ministry of Health, Ministry of Education, Ministry of Youth and Sports. And they have, after extensive capacity building, been able to do joint coordination as well as joint work planning and budgeting and monitoring of the program. So not to say it's perfect, it is not, but to just offer it up that it is possible, I think, if we're willing to invest and donors are willing to invest in the capacity building that's needed to make that happen. 2 other challenges are just meeting the rights and needs of very diverse populations of young people. As I mentioned earlier, yes, we are getting better at this, but there's still some key groups that are missing: married adolescents, young people living with HIV, lesbian, gay, bisexual, transgendered, and queer youth are often not being reached as well by our programs as they could be. I think I'm going to skip over this example just in the interest of time. The other one that I think is really important, I do want to highlight, is for so long in this field, many of us know this, we don't know what works for young people. We don't know what works for young people. And finally, we do know a lot more about what works for young people, and we've kind of moved much more in the direction of scaling those things up. That having been said, if we really want sustainable scale-up, we're going to have to not just advocate with donors, as it says here, but even, amongst ourselves in terms of generating and directing resources towards building ministries and CSO's capacity to plan, budget, and implement. Otherwise, it's not going to work. You'll scale it up, and 5 years later, there's not going to be anything there. And so 2 examples are Ethiopia and Mozambique, where they have been able to do this. But 2 things to highlight. One is there were significant investments by donors, and also the timeline was much longer than a typical project life period. So in the case of Ethiopia, it was 2 USAID back-to-back funded projects, and in Ethiopia, it was over a decade of UNFPA and other European bilateral support. And so just to end with a call to action, I think as we move forward in this room as implementers and advocates, we need to continue to advocate both at the global and country levels around some of these challenges. And Marianne mentioned earlier the Youth Health Rights Coalition. Many of us in this room are members. But if you don't know about the coalition, please see any of us afterwards. It is a unique coalition. It does have both implementers and advocates that have been working together for several years now to really advance mostly within U.S. government commitments to young people within foreign assistance, but some of the coalition members are also engaged at country-level advocacy. And if we really are going to translate the rhetoric from international agencies and country governments into reality, young people must be prioritized when it comes to funding. There really is a need for more advocacy, especially at country levels, but I think, as we heard earlier, young people have to be, at the forefront of that. They're the ones that are best able to advocate for their needs, and I know I've been hearing people say this for almost 2 decades, but it really is true, and I do think we all have to challenge ourselves in this room of how to do a better job in terms of partnering with young people. And then just to end with a note that I hope that all of us in this room will continue together to advance the sexual and reproductive health and rights of young people, but that we'll also reach out to others that have not been involved in this issue and really try to bring them along, because I think that collective action is what's needed, and we do need more coalitions that are maybe, that's not their core area of really getting engaged and working with us on this. Thanks.
That was a terrific distillation of a lot of the challenges that the implementers have. So I'm really excited that we have a younger colleague also here with us, and I've heard a lot about her already, and so we're really happy to have Christelle with us, and she has so much tremendous experience in a paragraph bio for a 20-year-old. It's really unbelievable. So thank you for being with us. It's great to have 2 phenomenal young people speak to us in less than an hour. So Christelle, here you go.
Thank you. This doesn't work.
I don't think that one's working. No, sorry.
Yeah, after all the technical talk this morning, I fear the only backup I have to what I'm gonna say is really my experience as a girl and growing up in a developing country in Rwanda, and just having a particular advantage in my life and a weird viewpoint. If you have read my short bio, you probably already know that I am Rwandan and that I am training as a mechanical engineer. That is something that mostly shocks people. First of all, like, you're a female in engineering, yes, and I actually love it. And then at this type of events, people normally go like, what are you doing here? Mechanical engineering, family planning. But isn't that where we're trying to get to, where every woman, no matter what you're doing, what your profession is or what your career ambitions are, that you can be comfortable talking about family planning because it's an issue, something you understand on a personal level, something you own, not just information out there. So that's what I'm doing here, and that is what I was doing in Ethiopia last month for the International Conference on Family Planning. This last Sunday I turned 20, and part of my celebration was that, yay, I have escaped teenage pregnancy. But that is not the full thing. I have escaped it not by chance, but by choice. And that is not an option that is given to many young people back in Rwanda and in many developing countries. And even here in the US, even with all the available information and commodities, sometimes it's really a chance question. So in Ethiopia, I presented to a group of ministers one slide of data on unintended pregnancies among young people. But bigger than that slide was my own personal experience as a young person, and the fact that I have seen 2 of my childhood close friends become victims of unaddressed SRH needs by becoming pregnant. Shocker. First, as a child, I blamed them, and I thought they were bad girls. And I kind of felt weird because, I'd been associating with these girls, and now, since they were pregnant, society was labeling them as having failed. Second, as a teenager, I was living in a very changing urban area, and I learned of different ways to avoid unintended pregnancies and STIs. I learned about using condoms, and I actually used to distribute them for free to my friends, and I'll talk about that later. But then I also learned that if I had had the condom and given it to one of my friends, I could have stopped that unintended pregnancy. And I was actually, they were around 14 and I was 9. I usually chill with older people, but just learning of that as I grew older made me feel in a way I had been powerless to help them when they needed me, when I could have helped them, but also kind of blaming older people that they hadn't done their job. Later on, as I grew up, like more recently, 1 year ago, I realized that I have a chance to change that. And that is another reason why I'm getting involved now in advocating for family planning, among other things. Someone once said that we like to pretend our parents do not have sex. I think that was Kate Gilmore at the ICFP. And our parents either don't know or trust us too much, or they pretend we're not having sex. In most cases, though, young people are having sex. See, those two childhood friends sat with me in a science class that had the unit on reproductive health. It is part of the national curriculum. We learned how babies are made, we learned about prevention methods, but no practical information was offered. We did not learn how to actually use those preventive methods or where we could have access if we decided to use them. Let me tell you a story about my mother. She's a woman in a community that doesn't talk about sex, and where women are labeled a negative image when they want to have access to contraceptives and other commodities, especially if you're not married, or even when you're married and trying to not have more kids. Sometimes you're labeled a bad image because of that. If it wasn't for my mother, a lot of women in my community would have never had access to the contraceptives they needed. And I remember being about 11 or 12, some women in my community would visit my mom, sit with her, and then she would always go to a back room and then come back with a package. And it went on for a while, and then I started wondering what was that. So I visited the back room, and then I realized there was like a package of condoms, and she had these beads, like the menstrual cycle beads, and she would give it to them. And I started doing the same. I started giving to my friends, and one day she caught me because I was doing it without her knowing. And she called me and actually was happy I was doing it, which was surprising because my mom is really good at giving me books and information about reproductive health, but we still can't talk about it personally, eye to eye, because that's the community we're in, and I hope it changes with time. But even her being a reproductive health specialist and always talking about these things in public, I've sat in one of her talks, but we can't have that kind of personal communication at home. So, and I hope that's something that changes, and this is my particular advantage as a young person, that I had a mom who was able to train me personally, teach me, and even tell me, yes, it's okay to have condoms on yourself. You can make a decision about your sexual life, and here's something to help you. And since my time is running out, let me stick to what I have. I wish I had given condoms to my friends. Pregnant and young mothers often largely fall off what I call the grid. Their access to economic, educational opportunities are limited after a pregnancy. And so much focus can be given to prevention that we forget about the very numbers that made us care enough to start working on prevention. And a lot of times, young mothers are left to fail. And talking about numbers, as I prepared my presentation with two amazing ladies from PRB, Marissa and Kate, we had a hard time just finding data about youth. For example, no countries gave data on what percentage of their population were young, and I really had trouble finding data. Young people have needs and face way many challenges than some of the generations before them. This may come as a shocker to many, but we want to be part of the solution. And Jay kind of touched on that. And through many creative efforts, young social entrepreneurs have provided solutions where governments have failed to act or spent way too much money and accomplished nothing, and caused maybe sometimes more collateral damage than solutions. And being an aspiring social entrepreneur myself, I work with a lot of youth initiatives trying to solve different problems, such as the water crisis, the lack of reading materials, social justice, and a lot of others. And if I may kind of give you a little bit more information on how we solved the water crisis, which I think we did. Building a water well normally cost $15,000, and now young people, an organization run by young people, can build the water well for $1,000. That is a huge improvement, and they use a hand reading technology, and that's something I'm really proud of. And I hope to see even more young people being supported to scale these small projects to small communities. And I have to say this, this is an exciting time to be a young person in emerging economies, not because of the increased amount of problems out there, but because we are no longer just the troublemakers, but we can be solution makers, and we are striving to be. And that is something that implementers and governments should really consider and take advantage of. Don't just establish youth centers and tell us to play basketball. Partner with us and actually learn of our work and invest in it. Thank you.
Terrific, and I think there's a lot of rich content that we've heard from the three speakers. There's a lot of great things happening in this space. As Gwyn said, I think we have come a long way on these issues, and there's a lot of energy and ideas from young people themselves. We still have to try to bridge that gap between the policy of a large funder like USAID and even the implementing organizations that still struggle to figure out, well, how can we really break through in this particular country, or with this ministry, or with or with in this community where the young people are the adults are kind of putting up barriers left and right to them to being empowered and getting the information and the services that they need. And connecting to economic opportunity, et cetera. There's a lot of barriers. But I know we have a lot of ideas about some of these things in the room, and probably questions for one or more of our speakers. So I'll open the floor and see who wants to raise their hand. So thanks. Yeah. Or you can take this one if you want. Anyone? Suzanne over there in the corner.
Hi, Suzanne Petroni from ICRW. Thank you all for great presentations and for focusing on this very important population. Marianne, thank you for your openness to inputs from NGO colleagues and the YHRC in particular. We're thrilled that you've been so open and collaborative, and clearly the action plan that we talked about is reflective of a lot of the inputs we gave. So truly, thank you. Action plan sounds great. Where's the money behind it? The Youth Power IQC, many of us have been waiting for almost 2 years now. The draft came out in May. We have been told repeatedly that its actual issuance is imminent, next week, next month. Please, let us know how we can help you get the money to go along with the youth development policy. And if you have any updates for us, we'd love to hear those.
Well, that seems concrete and specific.
It's imminent. No, I know that's been a question for some time, but it is imminent. And because it's procurement sensitive, obviously I can't say much more than that, but we are also very anxious internally on getting that out, because I think it's an important opportunity to explore a lot of what we've been talking about. So just keep your ears open for that. I would say that it's been from within USAID, it is, like in many of your organizations, it's challenging to design cross-sectoral, just all the bureaucratic issues that come up as you move a process forward, and when you have monies from different places. I'm not speaking about youth power, but just generally. So it is imminent. Policies a lot of times don't come with money, and that is a challenge, and so it's about how to orient the work that we're doing differently. I do think that sometimes lessons learned show that you do need some funding, at least, to be able to do capacity support, to be able to kind of incentivize different ways of doing things. So internally we're trying to advocate for that, but we hear that there are those challenges. But in any case, we are trying to identify and work with key missions in different places that do have funds. I think the second objective of the policy is extremely interesting, because it is about mainstreaming youth and looking at where we have large initiatives that do have funding, and how can we actually ensure youth voice in those initiatives. So there's some kind of a lot of thinking around that as well. But sorry not to be able to give you a more concrete answer than eminent. But